Hi everyone. I would like to thank everyone for participating on this COVID-19 X Healthcare Seminar. It is the first of the 5 series that World Affairs Council Pittsburgh, in collaboration with Global Minds, will be holding. It will be a space for the youth to have conversation about. Um, I am so excited to have this conversation with everyone, especially that we have speakers who are going to give their insights about this pandemic.
So before we begin, I'm going to give you a brief introduction to Zoom. So a brief introduction to Zoom is when you see your lower left corner, you can see the mute unmute button where you can mute or unmute yourself if you feel like asking questions, you can unmute yourself, but please do remain muted. And next to it is the video button where you can turn on or turn off your camera. If you don't feel comfortable, you can turn it off, but we really encourage you to turn it on because we want to see your beautiful faces. And next to it is the chat. You can if you don't feel like voicing out, you can actually just text it on chat, and we have Luke to manage that. And next to it is the gallery mode where you can adjust your. Next to it is the emoticon where you don't feel like you feel like having this like clap button or you have this like button. You can just use that if you feel like it. So you may notice that we are recording today's seminar. However, this video will not be shared where students' video or identifying information are visible. We encourage you to keep your video on and to join in on the conversation during the Q&A portion of the seminar.
Okay. To start up, I would like to introduce myself. I am Alexis Ipondolan, and I just graduated senior at Taylor Alderdice High School. I will be going to Duquesne University. I will be majoring in biological sciences, and I am an immigrant from the Philippines. Being able to experience the healthcare system of both the developing and developed country, I see differences and major differences. So I am taking this opportunity to share with you guys those differences. I am joined here by my partner who is all the way from the Philippines.
Hi, I'm Alexandra Sarasaba. I'm currently a senior at Science and Technology Education Center, and I'm currently at the Philippines. So yeah, so I am really interested in this topic because ever since as early as kindergarten, I have been wanting to be having this career in medicine and having this opportunity to share this with you guys with the help of our speakers, medical frontliners from the United States and the Philippines. It's a really big opportunity to be here, and it is really good. Yeah.
Okay, so today's seminar is part of a series of virtual events framed around the Building Back Better, or BBB agenda. The COVID-19 pandemic has highlighted our profound connections through humanity while reminding us of the persistent injustices that continue to live in our world and in Pittsburgh. Following the Council's established tradition in presenting innovative programs and activities on global issues, we are launching virtual events framed around the Build Back Better agenda. This international agenda was created to have a holistic approach to post-disasters recovery. It encouraged us to evaluate and rethink our society, and instead of rebuilding things the way they were before, to build our system to be more just, equitable, and resilient than before. Our goal is for our public programs to be a platform for diverse audiences and speakers to come together and build stronger, more resilient connections that transcend all communities so that as we move forward, we will be stronger together.
So yeah, so today's seminar will focus on how COVID-19 has impacted the medical field and how young people can be active participants in building our healthcare systems back better. So yeah, we are joined here today by two speakers who will share their perspective as frontline medical workers responding to COVID-19 in a developed country, the United States. and a developing country, the Philippines. We hope today's conversation will serve as a snapshot of responses, efforts in these two places, and will spark your interest to explore how COVID-19 is impacting other countries and regions around the world.
For more information, we encourage you to check out the background resources shared with you via email prior to the seminar. Before we start this seminar, we prepared an icebreaker for everyone, so I hope everyone will participate.
Yay!
Thank you so much, Alexandra, for that fun icebreaker. Let's proceed to our next activity. I will be showing you guys a short clip about how United States is responding to this pandemic and their struggle during this crisis. So I'm going to screen share. Okay, so that was that for the short clip. I forgot to mention that if you guys are having difficulties on seeing that video, we will put like the link of that video in the chat and you can access it later in another browser. So let's proceed to our first speaker from the United States.
So for our first speaker from all the way from the United States, Melinda Morgan. She is 31 years old and was born and raised in Bay City, Michigan. She graduated from University of Michigan, Flint with a Bachelor of Science degree in Health Science and Healthcare Administration. Melinda served in United States Peace Corps from 2013 to 2016, where she worked as a community HIV outreach volunteer in South Africa. Currently, she works at Covenant Hospital as a nursing assistant while working towards her master's degree. Working alongside nurses, doctors, and hospital staff, Melinda is able to help ensure a safe and speedy recovery for patients in the neurotrauma progressive unit of the hospital. She has experience taking care of COVID-19 patients and has had to work in responses to many staff members, including herself, testing positive for the virus. So let's have Melinda Morgan.
Hello, everyone. In response to the questions given, I'm just going to go over some of the things. The video that was just played actually covers my experience greatly with the virus and the hospital that I work at. With this being said, this is just my perspective on everything. Early on in the pandemic's history, no one really knew how serious it was going to be. We weren't required to wear masks at our hospital, and no one knew that the extent of the virus was going to reach what it did. Testing wasn't available for staff members or anyone unless they were receiving or experiencing extreme symptoms that almost required you to be hospitalized. If you were having a light cough or a low-grade fever, you weren't being tested. So testing was very limited in the beginning, like the video had said. In about mid-March to late March, they decided to require all staff members or any visitors entering the hospital to wear masks, which is, extremely difficult on a 12-hour shift because it's difficult to breathe, as all of you have warned them, I'm sure. So it can be really stressful when you're not used to that. I know it makes me extremely warm and it's just not fun. So that was like a big adjustment from working with no masks to requiring the masks. Then April came and numbers were increasing, and our hospital canceled all unlife-threatening procedures. So anything like knee replacements or hip replacements or things like that were canceled. People were suffering with pain, but they could not go through with their procedures because it was too risky with the virus. And we had to exhaust our ICUs and many floors of our hospital to take care of just the COVID patients. No visitors were allowed to come into the hospital, which can be extremely stressful if you have a sick family member. You just want to be with them, whether it was COVID related or not. They weren't allowed to come. I think what hit me most with the video you played was the reality of that things were changing on a daily and hourly basis. 1 minute we were told that we have to wear this certain PPE, which is protective equipment, the masks, the gowns, their face shields. And then the next minute they were saying, well, we're running out, so you don't have to wear this, which it was extremely stressful for all staff members. We had to start social distancing in the hospital on our breaks, and while we were at work, we couldn't take breaks with a certain amount of people. And then obviously the shortage of PPE, like they discussed in the video, the fear that you would have to take care of patients without a mask or without the equipment. Luckily, Covenant, which is the hospital I work for, issued an N95 mask for every employee at the start of it, and we were told we have to reuse it, which normally that isn't the procedure protocol. Normally you would get a new one for every different person you're taking care of, but with these circumstances we were forced to use the same one. Then what kind of happened in the end of April is we were seeing staff members come down with COVID, and we were extremely short-staffed. I know on my floor alone, I work on a neuro trauma unit, and we did not specifically take care of COVID patients, but about 76% of our staff members actually tested positive for COVID. And so during those times, we were forced to be off work, leaving the hospital short, and it kind of trickled throughout other floors. And so the staff, when they were at work, they were just probably coming back from having COVID or before they got it, and you're extremely stressed because you're working at about half the capacity as you're supposed to. So it became extremely stressful. And the health department and CDC actually recommended, I found this interesting, that when this came out, they recommended that if you test positive or if you're showing symptoms, that you self-quarantine for 14 days. Well, healthcare workers were held to a different standard because they needed the staff to come back to work. And so healthcare workers were only required to self-quarantine for 7 days once they tested positive, unless your symptoms persisted or you were in severe condition. So our hospital were kind of forcing, based off of CDC recommendation, that our staff come back before they may have really should have, or, you know, we don't know how long the contagious period of this virus is or was at the time. So there were so many unknowns that made everything extremely stressful. And if you have any questions during the question and answer about having COVID, feel free, I will answer anything. I just, I will wait for that period. The second question was, do I think that COVID-19 should be prioritized over any other viruses like HIV? My response is kind of yes and no. COVID-19 is a novel virus, which is new, and we don't know anything about it. Obviously now we're starting to learn more, but in the beginning, we had no information. So I believe in that case, you should take priority and learn about it. With HIV, we've been studying it for decades. We know how it's contracted. We know how to prevent it. We have medications for it. So as much as I believe it's important to not prioritize one over the other, because the COVID-19 is brand new and unknown in a lot of ways, I think it should take priority until we can have more information about it. It's kind of like put out the fire where it is right now, because it's spreading rapidly and, you know, it's a global pandemic. So let's try to take care of that fire, and then maybe once it calms down, we can focus on everything else again. As far as how the virus has affected the states, I think most of us are in the United States, so we've kind of seen it in our everyday lives. But in my personal life and in Saginaw, Michigan, where I live, it's just been kind of a bizarre turn of events. I was talking with my grandfather. He's 93 years old. He has seen it pretty much a lot in his lifetime, and he said that in his whole life he's never seen anything like this. The Spanish flu, the Great Depression, there's never been a time in his life where things were closed to this extent, or people were kind of afraid to be around each other. So it's just interesting that the effects that it's had, and whether it's based off of the fact that we have social media now, we're able to communicate better, or if it's just that it's such a new virus that we don't know anything about it, and it's scary. I work a night shift, and one of the hardest things for me was that normally I do all my things at night. I go grocery shopping in the middle of the night. I do all my things and activities at nighttime, and so it's been kind of difficult to adjust to that. And I think a lot of people who are on fixed schedules and different things have had to kind of suffer through the changes that we're going through with this. Anything else I wanted to add? It's not all negative, I will say. We have had at our hospital an outpouring of support and positive feedback from our community, from our friends and family. We have had meals delivered to the hospital for almost every floor and every staff. We've had notes of appreciation. We've had drive-by where people honk. I'm sure you've seen those like birthday honking parades and such, and we've had that. We've had bands come to play for us out on the lawn to show show their appreciation. And then overall, just the teamwork and support from each other has been outstanding. So as much as it sounds all negative, there is some light at the end of the tunnel, I believe. And then I know people are probably interested about some numbers, so I'm going to share some numbers that my hospital has endured throughout the last few months. So we peaked in April, and as of April 29th, the patients that tested positive that were inpatient, which means they were staying in the hospital, and this most of them stayed in ICU, but we were running out of ICU beds, so they had to make special accommodations on other floors. So at the end of April, we peaked with 76 in-house patients that tested positive, with an additional 181 that were being tested at that moment, which means based off the way the numbers were showing, about half of the ones being tested were coming back positive. So with that number, when you have a hospital that can hold 600 people, with 100 to 200 of those beds being taken away and put just towards COVID, that was, a third of the hospital was COVID at our peak. And that's utilizing all the ICU beds and stuff. So if someone came in with something unrelated to COVID and they had to go to an ICU, they were right next to someone with COVID, which obviously isn't ideal, but you have to kind of work with what you have. And so there was a lot of kind of mixed patients at points, because we had to do what we had to do. So that was the peak, and that was the very end of April in Michigan, in Saginaw, Michigan. Currently, which is really, really awesome to see, is as of June 29th, in-house, we have 12 patients positive for COVID. So we went from about 125 at one point to 12 patients. So obviously what we're doing in Michigan is working, and hopefully other states can see that. But I just wanted to share Covenant's numbers with you. And as of the 29th, we are able to test up to 6,000 people a day. So that's also really, really cool, especially going from the beginning where they were turning people away to test. And now anyone can test, whether you have symptoms or not. If you just want peace of mind, you're able to test, which hopefully can help with the spread as well. I am excited for any questions. I just wanted to kind of go over the questions given, and I can elaborate on anything else. I don't want to take up too much time. So that's my perspective from Michigan.
Thank you so much, Melinda. That was really very informative, especially like the statistics that you gave was very helpful. I remember when you mentioned about like the equipments, the mask equipments, I remember reading an article in like the New York Times about how this nurse quit her job because they're not given like the right equipments to handle COVID-19 patients, and it's really sad that that's happening. Okay.
Also, I just want to point out how Melissa mentioned that COVID-19 is a novel virus, which is like really new. And I think the audience needs to know that like what about other diseases like aside from COVID-19, like why is this like on priority? It's just a virus, you know. Like there are people that are not taking it seriously. So she just made it clear that we do not have enough information about this. That's why we need to prioritize it. Like we have information on how to cure other diseases, but having this coronavirus is a really new thing. So yeah, I just want to remark that.
Thank you so much, Melinda. Okay, so for the next, we are going to have another speaker from the Philippines, but before that, I'm going to share a short clip about like the COVID-19, how the COVID-19 has affected the Philippines and how they are handling that in hospitals. Okay, now that we're done with the video clip, we are going to have Jana, Miss Jana. She's going to give us insight about how this COVID-19 has affected the Philippine hospitals. All right.
So a brief introduction to Miss Jenna. So Miss Jenna is a nurse in the Philippines who worked on the front lines until March 2020 and is well informed about the current response to COVID-19 in her country, which is the Philippines.
So hi everyone, good afternoon. So basically when COVID-19 became rampant worldwide or in my country, I can say that nobody was really ready for it since we were not that familiar to the virus as to its mode of transmission or its virus strain or how it affects a person and its virulence. It's not familiar to any of us, so we had to adapt to these new changes. So when talking about the medical situation here in the Philippines, I'm gonna be basing it in my own experience as a nurse and from what I have observed. So first, I'm gonna be talking about some issues, and first issue that we are going to be tackling is from the hospital that I'm working, we had to adapt to new changes. We had to follow new protocols to protect us from the virus, and isolation rooms were made since we had to isolate patients that are COVID positive to the patients who are not, to prevent the spread of the virus. And also, we also had problems with the shortage of PPEs. We had to ask help from other organizations to help us with our PPE problems. And also, some health workers were terrified with the situation that we are in. We also had experiences wherein we lack resources that are needed. So we had to prioritize patients according to their needs. Other issues of the most of the hospitals here in the Philippines is that some hospitals cannot accommodate more patients since the cases are rising. So some hospitals are are not ready for it. So they had to increase their bed capacity. Also, there are problems with being understaffed since some of the staff nurses or nursing assistants or other medical health workers is already positive with the virus. And also another issue is that we also experience discrimination from other people since they are thinking negatively towards the health workers because they are thinking that working in the hospital they are exposed, so they are thinking the nurses as a carrier of the virus. And also there is a spreading rumor about how COVID-19 is a hoax. What is your personal take in this? Yes, I have heard a lot of rumors about this COVID-19 or any theories wherein it is a biological weapon from China or any other theories, basically. So my personal take on this is that whether it is true or not, a person is suffering from this condition. It is not a joke, and being it mild or worse condition, what matters is focusing on the health or the condition of the patient. And also, there are a lot of medical issues that we are facing, like HIV. How do you think COVID-19 is more important than other existing viruses? Do you think it's worth being prioritized? So basically, there are a lot of existing diseases, but whatever symptoms the patient is presenting, we attend to their needs and also assessing them well if how much treatment they need. I don't think other diseases should be set aside. The most important thing to focus is the health of the person or the condition of the patient. So that's all. That's all I'm going to share. And I'm open for more questions. Thank you.
Thank you so much, Ms. Jana. We really appreciate your informative insight. We're going to continue this conversation with Jana and Melinda, and would like to invite all of you to join in. Please add your questions to the chat. This is a dialogue, and we want to hear your voice. If we call on you, please turn on your mic and ask your questions to the speaker. If you aren't able to access your mic or you'd prefer to not ask your question aloud, please note that in the chat. Please note that in the chat, and we'll ask your questions on your behalf.
So to get things started, we'll ask the first question. So most of this are like already answered. So I'll just go ask about like how similar, given that the United States is like a developed country and like Philippines a developing country, like they both have like this similar they both have this similar problem about the PPE, and especially when both are also similar on like not treating and not having it like the United States, they're not having it as like as serious as like it is right now. So yeah, I just put it out like the similarities about that. So we're gonna have questions from our audience. So if anyone wants to ask.
Okay, for the chat, Ben Quint wanted to ask Dr. or more wanted to ask Melinda about if it is more effective in the shortage to test patients with multiple symptoms or with little or no symptoms.
So in the beginning, there weren't enough testing to test those with mild symptoms. So what we experienced was that they were only testing people that had a lot of symptoms or very severe symptoms. Currently, they have enough tests to pretty much test anyone that wants to. So I just want to read the question. Is it more effective shortage to patients with multiple symptoms? So if you're speaking on a shortage of the testing, then I would say yes. If you're showing symptoms of the virus, those would be the people that would be more important to test, because they're finding that a lot of people are symptom free or asymptomatic with the virus. So if testing becomes if there becomes a shortage in testing again, I would say those showing symptoms would be more important.
Okay, so we have another question. This is for Ms. Jana. How does culture affect public attitudes about COVID-19 in the Philippines, like the US valuing freedom to not wearing masks or following rules?
So basically here in the Philippines, we had that problems. There's also a news that our president called us hard-headed because we won't follow rules. That's common, I think, in the US also. I've seen a lot of pictures. There is this one picture that Alexis sent me from the people who is not wearing any mask and not practicing any social distancing. So some people here in the Philippines are also doing that. That's the reason why until now we are still under enhanced community quarantine. That's the strictest quarantine that a place could be in. So we are in that status since the Filipino people, I can say I'm also a Filipino, but some of the Filipino people are also hard-headed. Wherein but I can understand them since they are concerned about their jobs, since there are a lot of Filipino people who lost their job due to the virus. So I think that's the reason why some of the people don't follow rules, or they are hard-headed because they want to survive for their family, to feed their families. I think that's the biggest factor also that affected all the people here in the Philippines. And it's quite sad that it happened since nobody was really ready for it.
Going off with what you said about the government in the Philippines, Ms. Jana, there is another question about how has the government of the Philippines supported the hospitals and nurses?
So basically, as I said through my speech, there were some discrimination. So the president and other governors here, the mayors pointed out that we had to respect the medical health workers or all the frontliners since they are very important, especially in this crisis that we are in. So they are the government is basically also helping the nurses to increase their salary, but I don't think that is followed since I don't know the government is not um that open-minded to it. It's like it's part of the discrimination that the nurses are facing here in the Philippines regarding to the salary, and I don't think that has changed even before this COVID virus. That has been the problem in the Philippines about discriminating the nurses with their salary. So yeah.
How about like the hospital equipments? How has the government
Oh yeah, for the hospital equipment, they are for most of the public hospitals, they are giving more resources, like the what do you call that, the ventilation machine, since it's really used in the most specifically in the ICU. So they are distributing mechanical ventilators, N95 PPEs, and also testing kits. they are distributing it to the hospitals here in the Philippines.
It's interesting to see how the government is supporting the Philippines. This is a question for Miss Melinda. How has your hospital, as well as yourself, reacted to the releasing of information by the WHO and CDC? And do you think the US as a whole has followed their guidelines as well as we should have?
Our hospital has been really open from the beginning. I know a lot of hospitals aren't sharing numbers. So as far as handling the release of information, Covenant Hospital has released them from pretty much, I would say, not the first month, because I think it was still unknown, and testing was a little scarce. But once testing became regular, every week there is an updated, it's on the internet, it's open to public, that you can go and look at how many were tested, how many tested positive, how many tested negative. And so it's really nice to get that number if you are seeking, it's for the public. So it's really nice. So I think Covenant handled that portion very good. As far as the WHO and CDC, I don't know when they started releasing numbers. I didn't really research that. But as far as every time I've gone to look at numbers, it's available. So as long as you're providing some kind of information, I'm personally happy with that. As far as guidelines, I think it was very hard, like we all talked about, that it's a new virus and that a lot was unknown. And it was changing. Once they figured out something new, they were changing the guidelines. So I think with what was given, it was really all that we could do as far as following what the guidelines were. So I think it was handled well.
Nice, thank you. I'm really interested on how, like, it was mentioned that you had the COVID-19 and how's that experience?
That's everyone's favorite question. So like I mentioned before, my floor that I work on got hit pretty hard. I believe we were one of the highest floors on the hospital, staff-wise, to all contract it. And like I said, it was 76% of our staff members tested positive. My personal experience with it was not bad. With that being said, I just felt tired and wore down. I had muscle aches. I did not experience any shortness of breath or any respiratory problems. Just pretty much, I just felt worn down and was very fatigued. I had symptoms of a cold, which I experienced like seasonal allergies. So it almost felt like that. So it wasn't quite real in the beginning, I would say. And I don't think I even questioned being positive because it felt like allergies to me. And it wasn't until we got results back a week later that we knew we were positive. And by that point, all symptoms were resolved. So I guess it might have been more scary if the test result came back right away and I was still having symptoms. But in my personal experience, it was very mild, and I was very lucky to only face very mild symptoms.
That's nice. Also, I heard that when this, like, since we didn't have like enough equipment on facing this crisis, like, I'm interested in when did you got the virus, and how was there like the test results and like the test kit, were you able to get that right away when you feel like you had the symptoms? Or
it was really a difficult procedure, actually, in my personal experience. It was in March, so I feel that in March things were very unknown still. I think the experience I had was a lot different than many people in June and you know, later on in the virus's response, because the testing was available. When I was feeling the symptoms, I wasn't actually allowed to get tested until my boyfriend actually tested positive because he was exposed at work. And they didn't think it was important for me to be tested until his test result came back positive. It was a little frustrating because they did not want me to stay home from work, even though he was exposed, which we lived together. So it was kind of frustrating to know that this person was exposed and I am in direct contact with that person. Yet, because I didn't have any symptoms at that point, they weren't interested in testing me or keeping me home from work. So it's, I'm not saying they handled it wrong. I'm just saying it's interesting, and maybe if we would have took more precaution, maybe there would have been less people that tested positive on my floor. I'm not saying that's necessarily true, but it's hard because if you don't have the availability to do the testing, how can you do it? If we had a perfect scenario, then they probably would have let me stay home from work and get tested right away. So it was a little fuzzy in the beginning. I think if someone presented with the same situation now, there would be no questions asked. You'd get tested right away, and you'd stay home from work right away. So it's just I think what would happen in any situation. We're learning, and it has to be a learning curve.
That's very interesting. So
So,
we're
awesome. Okay, so I have like a question for Miss Jenna. So since Dr. Morgan mentioned that there was like a drastic change from April to June, was there also like a drastic change like in the Philippines, like in the hospitals and like the positive, people tested positive for COVID-19?
Eventually, yes, they got the hang of it because basically they know what to do, on which symptoms to focus more, on what symptoms the COVID-19 presented and what's common on most of the patients. So I think they adapt to it with the wearing of the PPE since it's very warm inside. The nurses adapt to it. Yeah, there has been changes, big changes, and they also work together as a team to treat the patient.
Talking about like the positive cases, number of positive cases, was there a drastic drop or like a change from April to June?
There was a time where it dropped and then it go back up since the status of here in Cebu specifically changed into general community quarantine, which is not that strict. So when they shifted that, the changes went back up since the people started going outside, going to malls, not practicing social distancing or not wearing any mask. Like I said, some Filipino people are very hard-headed. So basically, that's the reason why we shifted back to the ECQ since the cases became high again.
Thank you so much, Miss Jana. Since we're running out of time, one last question for both our speakers. For young people who want to advocate on behalf of healthcare workers, what do you think is the most important information to share with the public?
I'll go first. I think the most important thing that you can do is just follow the recommendations that your city, state, country has put in place. I know in Michigan, our governor got a lot of, she was given a hard time for what she did in terms of closing down, and that is what she recommended, and it turned out to work in her advantage and our advantage because our numbers decreased significantly, and we are not seeing that rise again like a lot of other places. And so my personal opinion is that always follow the guidelines that either the CDC is recommending or that your government, your local government is put in place. And it doesn't hurt if it doesn't bother you to wear a mask. If personally, then it's not going to harm. Like you're not going to cause any harm by wearing a mask. So, in my opinion, if it doesn't physically or cause you harm in any way, then you can never be too safe, in my opinion. And then you can spread that information as well. And if you have friends that are not taking it seriously, it can be like, you know, it's not a joke, man. Like, so.
Miss Jana, do you have any closing or like thoughts about the questions?
Okay, so first, the very most important is follow the rules, follow the guidelines, and follow the protocols, and also be safe always. And the most important thing is you respect the medical frontliners, you appreciate them more, and respect them. Don't discriminate them. Instead, show your respect to them. That's the most important thing.
Uh, Thank you so much to both our speakers for joining us today for this important conversation and for giving us valuable insight into the medical system of the United States and the Philippines. We thank you both for your time and service. Okay, so we are certain that everyone will leave feeling better informed about the COVID-19's impact on healthcare, and we hope each of you will continue to research this topic and explore how other countries and regions are being impacted. Sorry we didn't get to all the questions that we have, but we encourage everyone to do research and research about your questions. At the end of this seminar, we will close with an activity about the digital tools you can use to take actions and raise your voice as we work together to build back better. We are going to turn it over to Luke to head us through today's activity about how to design infographics.
Hi, everyone. It's Luke again. I know we had some technical difficulties at the end of our seminar on Wednesday, so I thought we could re-record this portion of it for your convenience. You can watch this whenever you get the chance. So on Wednesday, we talked a lot about healthcare in the United States versus the Philippines, and we learned a lot about the very different ways that the two countries are handling the pandemic. And so while that knowledge is really important, it's also really important to translate that knowledge into action. And because the seminar and all of the seminars in our 5-part series are focused around building back better, we are including short tutorials on using your digital voice at the end of every seminar. And each week we will be covering a different topic in a variety of topics relating to digital voice. And then on August 4th, after our final seminar, iGeneration Youth, which is a youth-led media organization, will be hosting a full-length seminar on using your digital voice. So if any of these topics are of interest to you, you should definitely register for that seminar at the end of all 5 of the seminars as well. And that information will be at the end of this tutorial. So infographics. So when you're making an infographic, the first thing that people's eyes are drawn to is the color, and that color conveys a mood to your audience. That mood could be urgency, it could be growth, it could be precariousness, and the color palette that you choose should reflect that. So you don't have to be afraid to color things differently than how they actually look in real life. So for example, on this slide, we have a tree that's pink, and obviously trees aren't pink in real life, but the point still comes across. And a few things to keep in mind is that you don't want any of your colors to clash or blend in with the back. And you want to use a smaller color palette, so not too many different colors, so that your image doesn't look too busy. And a way you could do that is just use different shades of the same color, so different shades of pink, for example, and just make sure you limit the number of colors you use. All right, so Almost every infographic is going to have text of some kind, and there are many different types of text and many different uses of text in an infographic. So for example, headings and titles of your infographic are going to be in what's called display fonts, which are the bolder and bigger fonts, and they call more attention to themselves. Whereas text with a lot of words in them, like an explanatory paragraph, will be in body fonts, which are smaller and less bold. And to create a coherent infographic, it's important to, again, limit the number of fonts that you use, just like you want to limit the number of colors you use to prevent the graphic from looking too busy and just losing its impact. And so on the screen, there are a few different ways you can use text in creative ways to highlight specific statistics and organize your themes in your infographic. All right, another important component of your infographic is the data. And there are a ton of different ways to display data, and there's a ton of different kinds of data that you could display. So you want to make sure that you're using a method that makes sense for the data you're displaying. So here are just some examples on the screen. A pie chart would be used for percentages or proportional data. Line graphs would be used for changes over time, especially when those changes are smaller. And a bar graph would be used for comparison between groups or changes over time when changes are larger. And all of these types of displays have labels on them that make it very clear what they're talking about. And it's very possible that you could have data that's just purely informational and doesn't have numbers. And so for that kind of data, you can use timelines and flowcharts, depending on what makes sense for the data that you're trying to display. Also, if you can, it's really important to cite your data somewhere on the infographic. It makes the infographic much, much more credible and believable if you can say where you're getting your data from. Okay, so now I'm going to quickly walk you through the process of making this infographic. This infographic, again, is very relevant to the seminar. It's about GDP expenditure towards healthcare in the US compared to the Philippines. And so to make this infographic, the first step is to find the maps of the Philippines and the maps of the United States with transparent backgrounds. So those files, when you find them, will end in .png, and you're going to want to edit those colors of the map to make sure that they're a light blue color, which is a nice color for the background because it fades into the background, but it's still noticeable. And then you're going to want to use some sort of software to make a pie chart, input the statistics you're highlighting, and choose an orange color to contrast with the blue. You're going to erase the background of the pie charts and download them so that you can overlay them on top of the maps. And then you'll just add in a title and some statistic labels using a font that you think works well with the data that you're representing. And so there are a whole bunch of different softwares that you can use to make infographics. Some free options are Canva or Vector or Inkscape. And then some paid options that are more professional are Procreate for the iPad and Adobe Illustrator. So as I mentioned earlier, we will be hosting a full-length seminar on using your digital voice in partnership with iGeneration Youth in August. So if you found this mini tutorial interesting and you want to learn more, you should definitely register at the link on the screen. It's also the same link that you use to sign up for the seminar series in general. So if you have that link already, then you can just use that. And additionally, iGeneration Youth has opened up their office hours very graciously to any student that participated in this seminar. So these office hours are a really great way to work with students to draft stories. You can workshop stories, get articles reviewed and submitted for publication. So if you found this seminar really interesting and you wanted to write an article about it, for example, these office hours could be a really great way and a great free resource to use to get started. And as a reminder, we will be hosting another seminar on Wednesday, this coming Wednesday at 3 p.m. It's called COVID-19 X the Environment, where we will close out with another tutorial on using your digital voice in a different way. So some other way other than infographics. So that's all for me. Again, thank you guys so much for coming to the seminar, watching this video, and we will see you hopefully on Wednesday. Bye.